Welcome to each and every one of you, our listeners and people that have joined us today. It's always so wonderful to hear you, to have you join us whenever we do these wonderful insights on the couch. So I'm Sharlene Cassel, National Director of Epilepsy South Africa, and what a privilege to be here once again to address and discuss a brilliant topic, and we're going to talk about the Intersectoral Global Action Plan today. With our panel, we have with us, again, a wonderful, wonderful panel for you today. To my right, we've got Professor Mochan. Professor Mochan is Head of Neurology at WITS, and he consults mainly at Baragwana, so really in service to people with epilepsy, bringing his brilliance to us today. So it's wonderful to have you once again. Welcome.
Thanks for having me.
To my left, Marina Clarke. Marina Clarke is a disability activist, tremendously deep knowledge about epilepsy, about the disability sector, and she's our project advisor on the IGAP, or as we're going to talk about, we'll reference it to the IGAP, but it's the Intersectoral Global Action Plan. Our third guest today is Laurianne Brown. When I met Laurianne, I was so excited to meet her because I'd never met somebody who had 3 generations of epilepsy. Laurianne's mom had epilepsy, she's a person with epilepsy, and both her daughters, today are 15 and 16 or 17, I think, Laurianne will share with us, have epilepsy. So we always note in our sector, and we go, somebody will talk to us about epilepsy, and I'll always go, when they get involved, that's great, you've got epilepsy. So today I'm really excited to have Laurianne, and of course for those who've joined us for the first time today, I'm proudly a person with epilepsy because I have the privilege of sitting here and discussing epilepsy today. And to say to you is, what's the mission of Epilepsy South Africa? And our mission is to promote the human rights of persons living with epilepsy. So we're here in service of you. Without further ado, I'm going to redirect myself and bring Marina into our conversation today on the Global Action Plan, the Intersectoral Global Action Plan. Now, Marina, just give us a quick introduction about what is this thing that it's a buzzword now in our global community. We're talking about it, and why is it so relevant to us? What is this document?
Yeah, it's known, Sharlene, as the IGAP, because Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders is just too much to say. So we refer to the IGAP. It's a document that really grew out of probably about 20 years worth of work in the field of epilepsy. It started with the Global Action Campaign, bringing epilepsy out of the shadows, and that's about 20 years ago. So it's been a long process, but in 2015, the World Health Organization adopted a resolution, and for those of you who want to go and check the resolution, it's 68.20 of the World Health Assembly. And it really said there's a major problem with epilepsy around the world. It focused on what became known as the global burden of epilepsy. Now, we know there's about 50 million people in the world with epilepsy. So it's a lot of people, and it's quite a big problem. It did take until November 2020 before the World Health Organization said, well, if there's such a big problem, then we actually need to do something about it. We need a plan. And it can't just be medical, it can't just be psychosocial. It's got to deal with all aspects of a person's life, thus intersectoral. And this plan was developed between the World Health Organization and member countries around the world. And South Africa and Epilepsy South Africa was very closely involved in that process. And in May last year, May 2022, the World Health Assembly actually adopted this IGAP. And what it is, in short, is a document that highlights the problem areas and asks member countries to come up with plans to address those. And that's really what we're here to talk about.
Thanks, Marina. And I think as you're speaking, I'm sure a whole lot of you, and certainly Laurianne and Andre are already buzzing in terms of how this is relevant here. So I think just to contextualize and start the discussion, just to really introduce what is epilepsy, because when we start talking the Intersectoral Global Action Plan, I think there's a fundamental conversation that we need to say is people need to know what is epilepsy. And that's why today Andre is with us. So I'm going to just ask you, let's talk medical. Let's talk medical because it's going to talk into the greater conversation we're having today. What is epilepsy? Types of epilepsy? What are you seeing in your practice and the space you are working? Because you're really working across a huge space.
So that's one big thing. I mean, it's a big term, and that global action plan really speaks to, firstly, recognizing epilepsy. I think that's the first step, obviously, to recognize that as a diagnosis, and diagnose it correctly, and then treat and manage correctly, and then hopefully get people into the correct way of controlling it and living with it. So that's basically that three-step approach that is being talked about. But let's start at the beginning, like you said, talk about what is epilepsy. So when we talk about epilepsy, we perhaps should first start with the term seizure or epileptic fit, right? So that is what is the basis of this. So when a person has repeated or recurrent epileptic fits or seizures, that is basically then makes the diagnosis of epilepsy. And when we're talking of seizures or epileptic fits, there's a whole variety, and there is a whole spectrum of them. And some of them are easy to recognize, like the ones that we all are aware of, a generalized convulsive type seizure where a person falls down and has a major convulsive episode, which then abates. And then the person might be left there sleeping and wakes up later, drowsy and confused, that sort of thing. But there's a whole range of types of seizures really that can occur. And we classify them now more or less as to how they happen in the brain. And it's looking at, are they occurring in one particular part of the brain, in which case we call it a focal type seizure. And that reflects with more subtle type signs, whether there can be a movement or whether that can be just an awkward sensation, feeling, even some awkward thoughts or some awkward things happening in one's brain, to then more complex things where consciousness is affected and involved, where you basically become not aware of your environment, up to then those major motor convulsions that we have discussed. So along that spectrum, it's sometimes not so easy to recognize it. We diagnose the condition really if a person presents with two or more what we call unprovoked events or unprovoked seizures. We know that certain drugs, medications, alcohol, for example, exposure, sleep deprivation, certain sort of flashing light exposure can provoke seizures in a person who is not necessarily epileptic, but we make the diagnosis of epilepsy really in a person when they have repeated seizures, and that is basically what we're talking about when we say epilepsy. Sharlene?
I think, very recently my 12-year-old asked me, Mom, I've got such a cramp and my leg's been sore and it takes so long. And I looked at him and he asked me why cramps. And I said to him, you know what? You always ask me what epilepsy is. And it's when my brain has a cramp, a real serious, because I have a large amount of electricity that goes through my brain and a part of my brain goes into spasm. And instead of being sore, it has a real big cramp and it causes a seizure. So I think that's also quite a nice way for children, right?
Very nice analogy. So when we talk about epileptic activity, it's exactly like you say. So the brain functions on wiring. It's like a computer network, something. So there is electrical impulses being circulated. And when something goes haywire in that circuitry, ultimately, then that leads to what we see. You call it a cramp of the brain.
Yeah.
That is an epileptic fit. So exactly, we define it as an abnormal or sudden abnormal discharge of electric activity that happens in the brain. So that in fact is a seizure, and that is interesting. It happens, and then it passes, and then the person is basically afterwards back to normal. So it's an episode that happens like this. So it's an attack ultimately.
Great, thanks. Thank you so much. I think we're just contextualizing what is epilepsy right now and really having that conversation that people are really nervous to have, and that's why we're here today. So I'm going to jump into Laurianne, and you've got a fascinating story to tell, and I love it when other people with epilepsy share their stories and tell us. So tell us about your story. I know you've had recent episodes. Just share with us, and then if you just carry on speaking to why are you here to have the discussion about IGAP.
Okay.
Thanks, I'm going to just hand to you and off you go.
Okay. So I'm an epilepsy sufferer. My mom lived with epilepsy for several years in her early 30s. I significantly struggled with seizures more in my 30s as well, but a little bit in childhood. And then both of my daughters have epilepsy. Interestingly enough, both of them started when they were 7 years old. So they're currently 17 and 15. And all of our journeys have been so different. Mum's seizures were at night only. Mine, whenever.
So expressive.
Often provoked by a low blood sugar. My eldest daughter, hers is generalized epilepsy with frequent spikes. So everything from massive tonic-clonic episodes to absent seizures. She just, through her journey, has experienced a full range. And my youngest daughter's is temporal lobe epilepsy. So we've got a varying range of experience in terms of different types of epilepsy that we deal with various meds. And it's been a crazy journey, but a beautiful one as well. And in terms of why there's value in the IGAP and what it's all trying to do is our personal lived experience. It just desired so much more education. So the people around us, if they had known, if they had understood better, it would have made the journey easier. And I would love for that to be an experience for people coming up, in the future with the same journey, because the journeys are not going to end. But for example, my eldest daughter, when she had her second massive seizure, it was 20 minutes long, in hospital, and the nurses around her had no idea what was going on.
No idea how to manage
or
a seizure,
how
right?
to help. No, they stared. They stood there staring, waiting, so we could wait for the doctor to come and help. And we couldn't get the doctor there any sooner because he was in neonates dealing with the crisis as well. And so for that time, we were nowhere. We had been moved out of the emergency room and admitted into the pediatric ward, and the nurses, who were extremely kind, had no idea. And that was in a private hospital here in Joburg, and so education on that front would have made it a whole lot easier. That was her second seizure, so we were still newbies to the experience, and
parenting.
Watching your child have a seizure, we were newbies to, and how to deal with that. And you kind of really hope that the hospital staff will have some way of helping you, some more support, even just to go, we're doing all we can for her, the doctor is coming, instead of standing there looking in fear. Another one of the examples where education would have been fantastic for us was teachers. So my eldest daughter was in grade 1 at the time, and once she managed to go back to school from those huge episodes a few weeks later, I found that her teacher had no idea what she was going through, and understandably so. But if more information is more easily accessible, I might not have got a phone call to say, I think your daughter's faking it and using it to avoid schoolwork, when she was freshly on very strong medications and barely knew what was going on, couldn't count straight anymore, certainly wasn't faking it. So I think the benefit of something like the IGAP creating a need for policies to be implemented will really change both the experience of the epilepsy sufferer and the carer.
Thank you. And I mean, as you're talking, it's popping into my head. I also started epilepsy when I was grade 1, and reflecting as you're talking, I'm going, Sure, really more information would have really supported me and certainly my family. And I come from a medical family, so the conversation with what we're having today, and Marina's going to jump in now in terms of the objectives of the IGAP, the different pillars, the focus areas. I think the education and the availability of information, right? The availability of the doctors' network, really having the resources to share all this information would be invaluable to support you, right? Am I right? To be giving your patients all the time.
Yeah, I see the big thing is that to basically create a bigger knowledge base and acceptance of that as a condition, People have high blood pressure, other people have a heart attack. Yeah. This is epilepsy. So to have that openness of being able to discuss it as a condition, take some of the bewitchment and mystery and those kind of things.
You're getting into stigma.
Out of it.
Give that to Marina.
It's a big part of that. And one of the reasons why many people are unable or cannot access care is because of exactly those issues, you see. And that is something that probably the IGAP is hopefully going to address big time, hopefully.
I'm going to swing straight back to Marina because I can feel her. We do so much work together, and I can feel Marina sitting next to me going, I need to say something. I need to say on that. I need to say on that. So, Marina, I'm going to hand you the floor, and it's yours to talk to what Laurianne said, what Andre said, what I brought up, and let's hear.
I think both of you made really good input on this, and that's exactly what the IGAP is dealing with. The IGAP is a guide as to some of the issues that we actually need to be dealing with in this field. And it has 5 strategic objectives. Remember that it deals not only with epilepsy, but also with other neurological conditions. Things like autism and Parkinson's and Alzheimer's and cerebral palsy, all those kind of conditions also resort under this IGAP. So it has 5 strategic objectives, and I think you've already highlighted all of them. The first one is to deal with the issue of policy, as Laurianne, you said. If we don't have a policy that guides how we deal with things, whether it's government or outside of government, but I think it's particularly important for government for the simple reason that most people in South Africa do not belong to a medical aid. 16% of South Africans have a medical aid or have access.
Wow.
So the bulk of South Africans are relying on public health care. So having those policies in place is really important. And I'll get into how we implemented these. That's the first thing. The second thing is exactly what you were saying, Andre, that we need access to diagnosis, to treatment options, to the care aspect. So the more medical aspect of it. So that's the second objective of the IGAP, is to make healthcare accessible, relevant, timeous, and affordable.
Absolutely.
So that's the second thing. The third thing, and both of you highlighted this issue, is the access to information, the awareness, the education. It's a very simple thing. People don't discriminate against a person with epilepsy just because they're mean. They discriminate because they are fearful. And you refer to some of the myths that people believe. Epilepsy is contagious. So if I sit next to somebody with epilepsy, I'm going to catch it from them somehow. Yeah. And that's simply not true. But if somebody believes it to be true, they become fearful and they then avoid. So discrimination and stigma is caused by fear, which is caused by a lack of knowledge. So the issue of awareness and education, really important. And I can tell you in the next year, there's some really exciting events being planned to raise more awareness about it. So that's the third issue. And then the last two, the fourth one is the need for research. And you spoke about the need for different options, what treatments are available. The way epilepsy is treated now is very different even from 10 or 15 or 20 years ago. Yeah. There's new breakthroughs all the time, but we need that research to be gathered. And then the last thing is, and I referred to this right at the beginning, to use epilepsy almost as a gateway to healthcare for persons with other neurological conditions, so that the same can apply. Because when we speak disability in South Africa, it tends to focus on physical disability and sensory disability. So the so-called invisible disabilities are often neglected. So in short, those are the 5 main areas that the IGAP deals with.
Thanks, Marina. I think, again, there's a whole lot of comments that, in terms of what you're saying, and more questions. This topic is so broad, and it's got so much content. So the first thing, and I knew this would come up. It's coming up in my head. It's coming up from you as our listeners. Andre, talk to us about genetics. Talk to us about, can a mother hand their child epilepsy? Can it go down? What are the percentages of that? How often do you see it? When I met Laurianne, it was the first time I'd met somebody that had 3 generations of epilepsy. So I knew we would be having a quick chat on that, just to slide off the topic so that we can come back. Because IGAP also talks to that in terms of education, right? So just wrapping that.
In terms of hereditary epilepsy or genetic epilepsy, we have a very bad example here. So it's very unusual, and I don't even think, from what you've described now, this might not even be a hereditary condition. It might be separate, kind of condition. So most of epilepsy, so certainly epilepsy isn't passed through generations. So that's the bottom line. There are very few rare conditions where there is a genetic background to epilepsy. Some of them are actually directly heritable, but they are very, very rare and highly uncommon. So there is no concern in terms of giving epilepsy to a child or to the family, to family. So I think it's very, very important to be aware. By the same token, like you say, it's not contagious, so you can't catch it from somebody with epilepsy. It's also not hereditary, so highly uncommon that it runs in families. There are some percentages where there is a slightly higher percentage, perhaps, of children born to family members with epilepsy, but it's really negligible. So by and large, the answer is not a heritage condition at all.
Thanks. I knew we would have to just. But this talks into education, right? This talks into. So what I would like to come back to, Marina. We spoke to policy. All right. So as Epilepsy South Africa, we are leading this in South Africa. We're leading the domestication, the implementation of the IGAP. So it's a wonderful, wonderful project, and it's a privilege as an organization really to be representing an estimated 1 million people in South Africa that lives with epilepsy. And we're not even talking the other neurological disorders. So it really is a privilege. Can you dive into the pillar that I think is what Laurianne mentioned, was the education? Can you go there and speak to us? What are the things that, when this was being developed, that was identified as the important items to be speaking about, and the initiatives that currently are being planned to roll out now, concurrent to the implementation, domestication of the IGAP in South Africa?
I think what's important for us to understand, firstly, is that this is an international initiative. It's not only in South Africa, it's across all the member states of the World Health Organization. So it's pretty much worldwide. Africa, I'm very proud to say, has taken the lead in terms of implementation. And there's 4 project countries in South Africa, or in Africa, South Africa being one of them. But what we're trying to do is to take these guidelines and then make it real for people, because it's one thing to talk about policies and strategies, but it's really when the foot hits the tar that things start happening. So some of the issues is general knowledge about epilepsy. Between January and March this year, Epilepsy South Africa did a series of provincial workshops. Throughout all the provinces in South Africa, we had the opportunity to interact with people with these conditions, with their families, their carers, with government officials, people from organizations in the non-profit sector that deal with these things. So it really was a great fact-finding issue. And what became extremely clear is how limited the knowledge is, even of people diagnosed with that condition. Very often, particularly in public health care, the demand is so overwhelming on the medical staff that they don't have time to sit down and have an hour or a 2-hour conversation with either an individual or their family to explain exactly what it is. It's a case of get the clinical history, make the diagnosis, prescribe a treatment that's within the budget. So we have to look at this as a broader issue in terms of healthcare. So having that general information, what is the condition that I have? People, and especially parents, often ask, what caused it? Was it that one glass of wine I had when I was pregnant? Now my child has epilepsy. It's those kind of questions. And just for the record, in most cases, we don't know what caused epilepsy. It's far more important to look forward into treatment than to look backwards as to what caused it. What are the triggers? And then very importantly, what are the treatment options? The same treatment does not work for everybody. Different treatments are required for different people, so people need to understand that. They also have to understand the teamwork, the partnership between the medical professional, the psychosocial support, the individual, their family, because they all have a role to play.
So let's ask Andre for input on that, because he's at the coal front. So talk to us about that landscape, or the landscape of...
Yeah, so if you look at the public health sector, which basically serves our population ultimately, there is availability of medication, but the expertise might not be widespread enough, because we as neurologists, who are the specialists dealing with this condition, are relatively scant, particularly in the public sector. But notwithstanding that, medication is available, and it can be dealt with at a relatively lower level in the more simpler forms that we often find epilepsy and can be treated. The issue is that exactly like you say, the systems are often overwhelmed, and then that part of really approaching that as like a multidisciplinary situation where the patient family forms part of this whole discussion in order to really help that person and make that a successful journey with epilepsy is often difficult. So that is a big part of getting that right, and it is, I believe, part of the rollout of the IGAP, obviously wanting to broaden this. But ultimately, we do have, and we might say, okay, only 16% are on medical aid, but we do have relevant drugs and high-class drugs available in the public sector that we can prescribe. So the help is there, and we need to basically roll that out as much as we can to as many as needed.
Sharlene, can I just add to this that exactly the kind of thing we're talking about here is one of the initiatives that we're taking through this project in South Africa. On the 1st of September, we'll be launching what we've called the IGAP booklet, which is a little booklet that makes information available. What is epilepsy? How is it diagnosed? What are the treatments? How do I care for somebody with epilepsy? Where do I go for help? Those kind of things. So it's a really very practical guideline document for people with information, and it's going to be available, as I say, on the 1st of September.
Absolutely.
And I think that will go a long way to dealing with it. It also deals with some of the myths and misconceptions. One of my favorites is that they say people with epilepsy can predict the future. So I now have 2 people with epilepsy, and I'd like to please get the lotto numbers from you for this week, because that would be very helpful.
Laurianne, I think it's our secret, right? I think we should.
that people believe, and we laugh at it because it's complete nonsense.
Correct. It's absurd.
When people believe it, it's true for them. A child with epilepsy shouldn't go to school because they can't learn. People with epilepsy can't work. They can't hold down a job. They can't participate in sport. All those kind of things. So through this publication, we're trying to spread more information, make it available. And I think the shortfall that you're talking about, we don't have the time in medical care to sit down and have these conversations. That's why there's an organization like Epilepsy South Africa.
Correct.
So, visit the website, find out what's the branch closest to you, get involved, ask the questions. There's people who will make the time to sit down with you and your family and have this conversation so that you have real information and that you don't suffer under this blanket of a lack of knowledge.
I think that's you just hitting something we're all just discussing, such an essential component. And one of the things is education, education, education. So I know, Laurianne, if your kids were at school,
Yes.
then you went to homeschooling from what I understood. Now, what information would the school could have been given to improve their engagement with you as a family, to support the children, to what could the school have, what would, as the Intersectoral Global Action Plan, we have wonderful topics, we have critical topics, but what would they, just give me feedback on that, because I'm really interested. We're talking about, you've mentioned it, Marina's mentioned it, Andre's mentioned it. So if we start at grassroots level with it, let's have
So it's a great question, and I think it's a tough one, in the sense that in my experience and now getting to know more people with epilepsy, everybody's experience is so individualized. And so we can educate, and we have to educate, but we can only educate on a blanket sort of a level. And then from there, parents would have to work with teachers to go, okay, my child's experience is X. But having said that, for a teacher and the school staff to have much more in-depth understanding of epilepsy as a starting point would be a game changer. I'm not sure if it could be included as onboarding at a school or workshops, or how it could be done, but to have had a grade 1 teacher who understood epilepsy more than possibly felt this child was a burden in the class, which was definitely the case, that would have completely changed our experience of integrating back into a school environment. It's also a tough one. She was at a government school, and so I know that again, capacity is difficult. So possibly within a private school environment, you could hope that there are assistants, that there are extra staff members who could step up and assist in that environment. So if you're in a classroom and the child is very noise sensitive and sound triggers for her were big, and so a noisy classroom got her very close to seizing often, and so you've got a difficult situation in a school where there are 30 plus children in a class. It is a fact.
I want to throw this to Marina and to Andre. So the content that's being developed, how do you foresee the IGAP getting information to schools, to teachers, to all the stakeholders that need? How are we going to do that?
I found it very interesting, Laurianne, that you spoke about if the teacher knew more about it, was more accepting, it would be easier. And we often forget about classmates. Yeah. So educating children, even in grade 1, people often think that when a child is very small, they can't understand these things. But if you go to the Epilepsy South Africa YouTube channel, you'll find a series of animated videos geared for children that teaches them about epilepsy. And it's these beautiful little creatures. There's Campy, who's a little seahorse, and he has epilepsy, and how he tells his friends, and how he goes to school, and all those kind of things. So those kind of resources are already available. The IGAP booklet I spoke about will not only be available in English, it'll be available in other South African languages as well. And in fact, will be translated wider for use in Africa into a Swahili version, a French version. So making the information available really isn't the problem. No. It's a case also of, and I keep on saying, go to Epilepsy South Africa, speak to the people. But that's the reality, because they would be more than happy to arrange for somebody from the branch to go and visit a school or a sports club or a church or a social club, whatever it is, and do an information talk, answer people's questions directly. People often feel very frightened when a seizure happens. And if you're unfamiliar with it and you're standing in the checkout counter at the supermarket and somebody suddenly has a seizure in front of you, most people want to run away because it's frightening. the simple truth is everybody can learn what to do in a seizure, what to do in that moment when it happens. It's basic first aid kind of information. So that really needs to be brought to everybody. It should be information you have the same way we know what do you do if somebody cuts their hand?
Yeah.
What do you do if somebody has a seizure? It's that level of knowledge.
So many questions are running through my head because the IGAP is really this document that the World Health Organization has adopted. It's been adopted by 114 member states, I think you mentioned, or I know it to be a fact, but it's been adopted. Now, if we take from high level, and we're talking granular in terms of head of neurology at Wits, who's in the government sector, at cold face experiencing it. You're at cold face as a mom. I, as National Director of Epilepsy, I'm seeing it. Marina's been involved for many decades with epilepsy and disability, like I said. So what is the information? How do we take that for everybody? So let's talk into the actual, we're talking education, but how else do we connect that in reality? And I think I'd love to hear more from you, Marina, and from Andre in terms of what is needed. We did this wonderful road trip, we gathered this information, so let's maybe go there as a starting point, Marina.
I think what's really important, we referred to the road trips earlier, they didn't just happen because we had nothing better to do. When we looked at the IGAP, it's a very far-ranging, very broad document.
Correct.
And what we did in Epilepsy South Africa is we firstly did a survey, and we said to people with epilepsy and other disabilities out there, look at these things. Do you think this is what's important in terms of your lived experience? And we used that to identify the objectives of what we should do in South Africa.
Yeah.
That then we took on the road trip and said to people, this is what's been identified. Tell us about your experiences. What are the things you are experiencing day to day? All of that information came together in what's called the National Plan on Epilepsy and Other Neurological Conditions. And that's a document that sets out what actions need to happen in South Africa. We're working very closely with the Department of Women, Youth and Persons with Disabilities.
Yeah.
They're located in the Presidency, as well as with the Department of Health and the Department of Social Development and other role players, to really domesticate this, make this real in South Africa. So there's a plan in place. We're hoping that it will go to Cabinet for approval in November this year, and that we can then start the rollout thereafter. But already Epilepsy South Africa as an organization and the various bodies that it's involved with are already implementing some of the concepts around this. But I think that national plan is really important because it brings together all the objectives that we're talking about.
Again, I think it's thank you for consolidating that, because it did bring us together to how we get to the objectives in South Africa. And what I'd like to, do you want to pick up anything that Marina said?
Yeah, you see that going public is a big issue. So it's always advantageous if a famous singer has a stroke. It puts that, or has
That's
yeah,
terrible.
It's hard to, but this is
Or
exactly,
a cabinet minister.
for example, so those things I had a call. It's funny. 2 days ago, they called me from the SABC. There was a program this morning. I was invited. It's called Daily Theta or something. So they spoke for a whole hour. They had patients there. They had so that kind of thing, and they had social workers there. So people and they had family members and patients. So that kind of thing should be driven together with probably school education.
Mm-hmm.
Maybe should be in the curriculum. Mm-hmm. You learn about first aid. So maybe this is one of the aspects of what is a seizure. What do you do instead of running away, that sort of thing. So it's hard to say. There are so many angles to that, and it's a complex matter. But I think if we work as Epilepsy SA together, then I think if this filters through gradually, that would be we mustn't be living here in an urban environment. Think of rural places far away where there is very little reach of YouTube. Never mind that sort of thing. So that is basically it's a big task to achieve. But I'm glad there's things happening. So I hear.
Yeah.
I think also very important that, you're talking about the reach.
Yeah.
And one of the things we're doing is we're running a training program from August for the structures of the organization to skill people around the IGAP and those kind of things, so that that message can go out at local level. Because you're absolutely correct. In rural areas, people don't always have access to data or can access YouTube or any of the social media.
Absolutely.
But we have staff in the organization who actually go out to these areas, rural villages where there's very little access, and have face-to-face conversations. And I think that's why it's so important that this IGAP booklet is not only available in English, but also in languages that people can understand. So it's a combination. And I think the advantage we have is the information gathered through these provincial workshops and through the branch structures of the organization. They are in those areas, they speak the language, they understand the customs, they understand what the resources that's available. So it really requires a wide-ranging number of activities. And I think, there's an old saying, how do you eat an elephant? And that's one bite at a time. So I think that's the reality. The IGAP is a 10-year program of the World Health Organization. And because of that, it does give us a little bit of time to implement one thing. And within the organization, there's a very strong feeling we'd rather do fewer things but do them really well than try to do everything and not being successful in any of it.
I think, just to add to what you're saying, and I'd like to hear from you. I think, Laurianne, when I was chatting to you, and what Marina said, just to tie up, I think the strands, and there's so much being said, is that one of the things is that, yes, you eat it one bite at a time, and I'm glad you said that. So from Epilepsy South Africa's side, it's a case of our national plan has been submitted to the Disability Department as part of the Presidency's office. And the second thing is this wonderful booklet is being developed. There's workshops. However, this is the first of a series of videos or recordings as well. We're thrilled. And the importance of this agenda of epilepsy in South Africa is testimony at Sanofi is in partnership with Epilepsy South Africa on these webinars as examples. So we have a mom and a person with epilepsy. We were sitting outside and you were saying, you have these other moms saying, we'll speak to Laurianne. So now we're talking into capacity, into real capacity. So give me a sense of that. How do we escalate that? What's your opinion? What instead of having pockets or how does Epilepsy SA, because we can't be everywhere to all things to people. We're an organisation that was founded in 1967. So we are the only national organisation focused on epilepsy. So can we talk about the capacity? Because that's also one of the things very hardly driven in the IGAP is developing capacity in South Africa.
So let me just say first, listening to Marina just now, you can't help as a person with epilepsy but get excited and go, see, there's something in place and it's going to help. Yeah. And I suppose that the thought is every person that you reach is another person that won't have such a bad response when they come into contact with someone with epilepsy. And I think that's huge. So one more nurse reached, one more school friend, it just makes a huge difference. So that's very, very exciting. On the ground, I get calls from friends, from our doctor as well, saying, you've lived this experience. Here's a mom who's just started this journey. Can we hook you up? And so how to extend the Epilepsy SA capacity is a wonderful question. And I think it probably takes a lot of people who are already part of the epilepsy community to be willing to put their hands up and go, okay, here I am. I'm happy to have an online coffee with whoever, or an in-person one would be better, but sometimes distance doesn't allow. But I'm happy to have an online coffee. Let's talk it through. Let's figure out where you're struggling the most. Let's use our combined experience to benefit other people, because we learn so much from our own experience and over the years. So my eldest is 17. She started when she was 7. So I've been a mom of epileptic children since I was, for the last 10 years. Wow.
It's gone 10 years already.
So, there's a lot of time spent there, a lot of learning done, where you have to, as a mom or a carer, decide I'm going to be my family member's best possible advocate, and I've got to go and empower myself. And I suppose it's a case of knowing where to empower yourself, and that can be as simple as booklets and pamphlets in the doctor's rooms. It really is. It's
Aha, we're going to ask Andre. Yes. You're going to be on the spot with us.
Absolutely. But it is that simple. I mean, Andre said the meds are available, the treatments are available. Empowering people with knowledge when you have limited time because you're trying to see however many patients in a day, that's the difficulty. And so said booklet will empower not only the person who's just been diagnosed, but their family as well. And that makes a huge difference. Every little step just sounds exciting.
Yeah.
Can I just add two things?
Yeah,
On the table here, we have Epi News. And one of the things you're talking about is somebody who's had this experience. And Epi News is a publication about epilepsy by people with epilepsy.
Yeah.
And it really creates that kind of, here's real experiences. The other thing I'd like to just say is that we are currently in conversation with community media. There's nearly 300 community radio stations around the country.
Correct.
Broadcasting in pretty much every language spoken in this country at some stage. So there's conversations going on right now to form a relationship so that information can be made available through these community radio stations that are often in the most rural areas, speaking to a very specific community. So when you're talking about capacity, there's an old saying that says, each one teach one. So every person that learns really needs to carry that information forward to the next person. So there really is a lot of things already in place, things happening and being planned.
Absolutely.
And I really urge our viewers to get in touch with the organization and say, I'm a person with epilepsy, my next door neighbor has epilepsy, I've never heard about this condition, I'd like to learn more. Get involved, because the more people we have involved, the more we can spread the information.
100%. And that brings me to asking Andre. Andre, what information? You're in such a wonderful position, and it's why you've joined us today, because you're in a wonderful position where you've got such a sphere of influence. So if you had to look at this, again, the environment with healthcare workers, with carers, with parents, with persons with epilepsy, with doctors, nurses, all the stakeholders, if you could ask Epilepsy South Africa for 3 pieces of information to disseminate, what would they be?
Well, it would probably be just a little basic pamphlet to explain what is epilepsy and those basic myths, dispelling points to make about it. It would also have to entail that epilepsy is not just a disease of the person afflicted by it, but it really affects the kind of people around them. So it would have to involve, and right from the beginning, family, basically the bigger circle. So those would be the goals or the people at which that would be directed. And then the other thing would be really also, from Epilepsy SA, really to broaden the footprint into those corners of the country, really, where we don't so easily have access to or
we
reach.
need hundreds more people, okay?
You see, one thing is that, there is, and that is even, I think, in rural areas, there is a presence of these sort of community social workers, and they have a very broad reach, and they live within the community. So if we're doing that with some other another neurological condition, just as a pilot project at the moment, where we're trying to involve those community health workers or social workers to educate them about a condition, and that then filters through into the broader community. So that would be a good approach to take, actually.
And it's so interesting you mentioned another neurological condition, because here's the beauty of the IGAP, right? Is that the focus of the IGAP is epilepsy. But you heard Marina say that early on, it's and other neurological disorders.
Correct.
So maybe jump in there, Marina, because the IGAP actually lists other neurological disorders as a focus and has goals set out for those. So we partner with other organizations that focus on those neurological disorders as Epilepsy South Africa. So, yeah, Marina, just...
Yeah, I think the two things I want to say. The first thing is that Epilepsy South Africa is a founding member of the South African Disability Alliance, SADA as we know it. And that enables interaction between the organization and other national disability organizations.
Correct.
Often dealing with those kind of things, organizations like the Stroke Survivors Foundation, for example, that we have very close working relationships with. So that's one area where we cooperate quite a lot. But it's absolutely correct when we say that the need is so great to get information to people that it is almost endless.
Correct.
But again, we start with specific things, we deal with specific issues. The national plan that I spoke about earlier focuses really on the issue of health, access to health care, the issue of policy, and the issue of especially education and awareness. So for the organization as a whole, but also for the IGAP in South Africa, the issue of awareness and education, it's at the heart. It's the one cry that we heard throughout all the interaction we've had over the last year with a variety of people, including, for example, the International League Against Epilepsy, which is a neurological body that deals with it. And, you know, you were talking about educating healthcare workers and community healthcare workers. The ILAE run training programs for those health workers. So it really is a case of encouraging national, provincial, local government to ensure that their staff actually get involved with those kind of things so that they have the information and that people don't have to go through your experience of having nursing staff staring at a situation and not sure what to do next. So yeah, it's a big issue, but one step at a time.
As you speaking in the last few minutes today, it's the size of this task requires all stakeholders to be at the table, right? And that's why the disability department is walking with us. But when we talk about that, Epilepsy South Africa needs the resources to pull and to continue the reach and really, and I say resources, yes, it's capacity of people, it's funding, it's stakeholders like the Doctors Network at the table, private companies like Sanofi partnering with us for the series. It takes a lot of stakeholders here to truly make a significant impact in South Africa, because as Marina said, we spearheading in Africa as South Africa, as the chapter of International Bureau of Epilepsy in South Africa. So the resources are critical. And what I've heard from each of you is that we're all at the table representing different sectors, are really people with epilepsy, moms with epilepsy, partners with epilepsy, carers, because I've cared for my children, I've been cared for. I've been cared for. I'm not a parent of a person with epilepsy. I've seen how it's impacted my family as a medical family, even growing up a child with epilepsy, because, right, you'd agree, epilepsy is not curable. Epilepsy is a neurological disorder that you live with for your life. And at different times of your life, it goes dormant. And then it raises its head. I've always talked about my passenger. Sometimes it's quiet, sometimes it's having a dance on me. But that comes into it. So just last comments before we wrap up. Laurianne, just a last comment, maybe speak to our listeners, speak to our viewers, and just piece of advice for them.
I would say best piece of advice I can give is take a deep breath. It's going to be okay. There's an estimated 1 million people in South Africa experiencing epilepsy, and they all get through it. We all get through. As a carer, just decide to stand alongside your family member and be the best advocate you can. Equip yourself with the best knowledge that you have. That's my take on how to survive the days.
Laurianne, you've just, my heart's beat. I've had goose flesh 2 or 3 times when you've been speaking because it's hit so close to home for me, and I'm sure for our viewers as well, and I'm sure for our other panelists. Marina, closing thought to our listeners.
Just 2 things. I think the IGAP is a really amazing opportunity to put epilepsy on the agenda and other neurological conditions. So my plea to people is find out more, learn more, get involved with an organization that's close to you, but learn more and act on it.
Absolutely. You're both contextuals going, it's beautiful.
Yeah, so
Last to our viewers.
thanks for that. So
you've got a few things.
The common denominator of this other neurological conditions that are also under this umbrella of that IGAP is really disability, really. So because many of the neurological conditions, whether they are progressive or non-progressive, whether it's stroke, dementia, Parkinson's disease, so they lead to disability. But our task is really here, and that is part of the IGAP's plan, obviously, to help with that process of managing disability, both for the affected person to live with it. It doesn't have to be a limitation. No. In epileptics, certainly not. So that is one important thing to highlight, that it is about minimizing or reducing disability and rather enabling a person with a so-called disability. The other thing now, particularly pertaining to epilepsy, I mean, to just say out there that epilepsy is a completely treatable condition, manageable condition. Like when you have high blood pressure, you take high blood pressure tablets and control the blood pressure. So by taking medication, basically close to 90 or even more, around 90% of patients or people with epilepsy can be well controlled on 1 or 2 medications, and they can live a full and virtually an unaffected life in that way. So that's an important message to get out there. So it's not a sentence of any kind. It is a manageable, completely manageable condition.
Thank you, Andre. And from me, just some closing remarks, as always, it's just such a privilege to be here and lead this type of conversation, and as Epilepsy South Africa to just spearhead and educate and be in supportive of each and every one of you. And I'd like to round off and just say, again, our mission as Epilepsy South Africa is to promote the human rights of every person living with epilepsy. And the Intersectoral Global Action Plan is exactly that. And not only South Africa, but the global community is behind each and every one of you. If you want to get hold of us, please email us on info@epilepsy.org.za. We'd love to hear from you. We'd love your stories to contribute to our wonderful publication, Epi News. And thank you for joining us today. And please, we look forward to you being on our next webinar with us. Thank you.